Hi, my name is Grace Colbreth, and I'm going to start talking about the basal ganglia. So the basal ganglia as a whole is the largest subcortical structure of gray matter in the brain, and it is located near the thalamus. So the basal ganglia is divided into two parts, the caudate nucleus and the lenticular nucleus. So the caudate nucleus is located next to the lateral ventricle, and the lenticular nucleus is divided further into the putamen and globus pallidus, and the caudate nucleus and the lenticular nucleus are divided by the internal capsule. So there are three main functions of the basal ganglia as a whole. The first one is stereotypical movements. So these are movements that don't have to be learned on a conscious level. So an example of this would be yawning. That's not something that you have to learn, you can just do it. The next is an automated movement. So this is something that does initially have to be learned, and then it's mediated by the basal ganglia. So this, for example, is learning how to ride a bike. You initially have to learn it, but then from then on you can continue to do it. And then the third thing is tone. So tone is something that is the state of muscle fiber tension within individual muscles or muscle groups. And this is something that can be built through things like exercise and weightlifting. So when there are lesions to the basal ganglia, there are a couple things that can happen and syndromes or things you can develop. So one is Huntington's chora. So what this mainly is hyperkinesia, which is a movement disorder, and chora means jerky movement, not like fluid. So this is a degenerative disease that has an onset of around a 40 to 50-year-old. So what that means is that it is a degeneration of nerve cells in the brain over time. And what this impacts is involuntary movements, cognitive deficits, and dysarthria. So this is mainly impacting functional abilities and results in movement and thinking and psychiatric disorders. So there are some medications that can help prevent the symptoms, but nothing can necessarily slow or stop the decline. And there's also Tourette's syndrome that can occur when there's damage to the basal ganglia, and this is involuntary, repetitive, stereotyped movements or vocalizations, and these are usually called tics, and that is when someone will say like a certain word, sound, do a movement that is completely involuntary and repetitive. And lastly, there's Parkinson's, which is when the substantia nigra is impacted and there's a decreased level of dopamine in the brain. So this can have many different symptoms, such as like a pill roll, decreased coordination of movements, bradykinesia, which is the slowness of movements, and also a shuffling gait, which is just a less fluid walking. And then there is also something called Signment, which is a dopamine promoter, and it can be used to treat Parkinson's. But overall, it is, again, a neurodegenerative disease, so it is degenerating over time due to the lack of dopamine being produced in the brain. So moving on to the cerebellum. The cerebellum is mainly as a whole a feedback loop for muscle movements. So there will be a muscle or a motor movement sent from the cortex to the lower motor neurons, which is the spinal cord and the brainstem. And that message is also sent to the cerebellum. And what that does is it takes that information and pretty much determines how well the command of the motor movement is being executed when it's coming from the cortex. So this is important for rapid alternating muscle movements necessary for speech. And the cerebellum is divided into three main lobes. So the first lobe is the anterior lobe, there's the posterior lobe, and the flocculonodular lobe. So the anterior lobe receives proprioceptive information, which is a sense of your body position and posture in space, and this regulates posture. The posterior lobe is involved in involuntary and fine motor muscle movement coordination. And then the flacculonodular lobe is involved in the maintenance of equilibrium. And that is the one that is in the middle and is surrounded by the other two lobes. So this the cerebellum also has three main functions as a whole. The first one is maintenance of posture. So this is like what I said earlier, proprioception, the ability to maintain one's position in space. The second is the coordination of muscle movement, and that includes more specifically timing and precision. So one thing would be like finger to nose would be precision. And then there's also diadodyskinesia, which is rapid alternating movements, and that could be being able to do something like this with your hands. And then the third thing that it is a part of its function is motor learning. So the cerebellum plays a role in fine-tuning motor programs and learning things through the process of trial and error. So like I said earlier, riding a bike is a part of kind of the function of the basal ganglia. So the cerebellum would be adapting and the ability to make the accurate movements to learn how to ride the bike. And if there's a lesion in the cerebellum, there's a few things that can happen, but the main overarching problems with lesions in the cerebellum is planning and executing of movement. So ataxic dysarthria is one thing that can happen, and that is affecting respiration, phonation, resonance, articulation, and prosody. Then there's proprioception, which would impact someone's ability to maintain their equilibrium, movement, vibration, position, and pain that's received from all muscles, joints, and tendons. And then lastly, last two things. One is the impact on the ability of the range and the direction of limb movements, which is known as kinesthesia. And then there's also could be the development of ataxia, which is the incoordination of motor movements resulting from a lesion. Thank you.